I did my project on the herniated discs for the spine. So our spines are fairly fragile. They help us out uh, much throughout the day for our daily lives, along with basically all of the body systems in our body. Uh, the saying "woke up on the wrong side of the bed" is commonly used when someone's in a bad mood, but though it does have much truth to how we are affected so easily if one thing is wrong throughout our body. With our backs, if we don't stretch after sitting too long, have poor posture, or hit in the gym for doing some heavy weight lifts, of doing it improperly, we can also immediately feel the effects in our back. So what happens when one spot in our back goes too far out, if a contained bubble? Well, first we must know how the complex system is. So our spine is made up of 33 vertebrae, and in between them is discs to help cushion all the movement that we do throughout the day. This helps our spine move and bend a lot better than if it was just two separate pieces, like in action figures. It also is the central area in all of our nerves are connected to. Think of it like a train station. Each area has a specific section that helps direct signals to and from the body to all the joints. All these stop and go from our limbs and our muscles using the spine to safely move around organs without any pressure. So with these main trains and their stations, you've got the cervical, thoracic, lumbar, and sacral joints that help protect the spine. So these discs, for the disc, now each vertebra is separated by a squishy disc called jelly, if you wanted. The discs allow each spot to move without rubbing against each other. This allows the spine to move freely with little or no pain at all. And the different types of disc problems there are, you can see on the slide. You've got normal discs, and then you've got degraded discs. You crushed a bit. Kind of think of if you stepped on a soda can when you were finished with it. Bulging discs. And herniated disc, you can kind of think like a jelly donut. When you crush it, all the jelly and everything starts shooting out from one side, and that mainly is going to affect where the nerves are, pushing against the nerves, causing a lot of pain. Thinning discs, you're gonna get a little smaller and put a lot more pressure on your spinal cord. And then degrading disc, there's basically nothing left. And then, so a real world example, Jack works at a retail that requires him to move heavy boxes and lift furniture. And one day while Jack's lifting, he feels a sharp pain in his lower back. It hurts to move, improper lifting, and causes, that sharp pain that he's feeling in his back. Now he has to go to the doctor, and find out what's going on. And most likely he's gonna get a bulging disc or some type of problem to his back, as in the previous slide you saw. So how can this happen? The jelly-like discs that sit in between the vertebrae can accidentally break through the outer layer. This happens when the discs start pressing on the close nerves, making movement harder and painful than it should be. So the first stop is the cervical. The cervical nerves are basically in charge of the main hub for everything below our cerebellum. So basically, the neck and the shoulders are the main areas that the cervical is going to be working with, and those contain C1 to C8 cervical. Though it doesn't only just go to those 8 to do its job. The vertebra C1 to C4 helps control our head and helps aid the diaphragm. The neck and the shoulders are overseen by C4 to C6, while our upper limbs, arms, and hands are taken care of by C6 to T1. Getting more detail in C5 manages the biceps and the deltoid. C6 is the wrist and the thumb side of the forearm. The middle finger and the back of the hand is controlled by C7. Our pinky finger, is going to be controlled by C8, and that's all taken care of on the first section of the spine. The second portion of the spine is the thoracic, and that goes from T1 to T12, and those control, your breathing, the ribs, or controlling of the ribs, and the vertical column movement alongside tone and posture. Back muscles is most important job maintaining the thoracic vertebrae to protect the spinal cord and anchoring the rib cage. Poor posture can lead to back pain due to much of the body anchored by this section, as well as previously talked, going to the gym, trying to work out way too much than you should. And then the next stop is the lumbar, and that's basically your leg portion, and those vertebra that controls it is from T11 to L3, helps with the hip movement in our lumbar section. It's probably the most able name to hear, commonly referred to reference in seats for having enough support to help the body relax in these areas. So, and then you've got the sciatic joint. This is the very last portion, and this is mainly just going to be going for your lower limbs and rotation with the hip bonds connected to the sciatic joint. The next place to bend is at the knee, as well as going down certain portions to the foot and the leg. And then most people use the dermatomal map to figure out where the back problem is if they have an injury. Who can this happen to is basically, it can happen to anyone from older age to genetics to improper use of lifting techniques. Can cause bulging discs, as well as having muscular problems later down the road. And this affects the body. Not only does the bulging disc affect your spine, but it also affects most of the muscles, or affects all your muscles. The spinal cord is the major bypass for all nerval sensations that go on through your body. So if one section is hurt, it will relay that pain onto another system due to the cross of nerve signals. The main axis is going to areas the disc will affect is the quadriceps, deltoid biceps, and pectorals, and the tibial anterior. Dependent on the size of the disc, it will affect one side of the body, though if it is large enough, it can affect both sides. But every injury is on its own different compared to if someone messed up the same area in their back. They could have different effects. So one way is, many doctors will try to prescribe physical therapy and medication to help with back recovery if it's not too bad. If those methods doesn't work, within the 6 weeks, surgery is going to be your next step. For starters, back pain and less mobility are most common symptoms, depending on where the disc is, arm or leg, or the back pain. Numbness and tingling can occur, as well as loss of bladder control.